Hi everyone, thank you for tuning in. My name is Gisely Silva, and you are listening to or watching really to Salud Con Giselly. Today I have a really special guest, and I'm very excited to have her with us and be able to talk to her about something super important right now, which is skincare. A lot of people are going, relying on skincare as a little treatment, a little like bougie, treat yourself type of thing. So today I have Julie Powell with me. She's a great person. She's actually been my mentor for many years and different projects that I've had over the years. So a little bit about Julie. She's a licensed cosmetologist, certified skincare specialist, and certified laser technician. She has worked with plastic surgeons and dermatologists in Kalamazoo area for 32 years. Julie was the first to bring medical microdermabrasion to the Kalamazoo area. I can't read. For 10 years, she's owned and operated 10 or 12. How many
10.
years? 10 years. She's owned and operated.
It was for 10 years.
Okay. Her own skincare center, along with training other skincare specialists before joining the Parkway Plastic Surgery team here in Kalamazoo. So, please everyone, have a little like virtual clap for my very special guest, Julie. Hi Julie, how are you doing?
And I'm doing great. Thank you
Good.
for having me.
Yeah, of course. I mean, I had to, when I thought of who could I bring that knows about skincare onto the show, you were the first person that popped up. So of course I had to bring you on here.
Well,
Yeah.
thank you very much.
So I talked to you a little bit beforehand, and I asked, my peers and close friends if they had any questions about skincare, anything like that. But before even we get into like these specific questions, do you want to talk a little bit about yourself? I know I introduced you a little bit about your profession, but maybe so people get to know who you are a little bit more.
Well, you pretty much said a lot about me, but yeah, I've been in the field for 32 years now, and I've really enjoyed what I do. I can't imagine not doing it, but it's very rewarding to watch somebody's skin transition.
Mhm.
Especially I used to do a lot of acne when I worked with a dermatologist.
Mhm.
And that was very rewarding to help the young children and adults and stuff to get their skin under control.
Yeah, a lot of people think
So,
acne is very much for younger people, but I mean, everyone has it. Everyone of all ages has it. It's a very much. Do you see a lot of adults still suffering from acne and all the?
yes, because acne basically is pretty much hereditary and
Mm,
you can control it, but
mhm,
sometimes it just can't be cured because it is
mhm.
hereditary.
Right.
Now, there are things that dermatologists can do, like Accutane and stuff, to
Mhm.
really help with that,
Yeah.
but that's a pretty powerful drug.
Okay. Okay. Well, if you guys need anything done, please go to Parkway Skincare and my girl Julie will hook you up. But okay, so let's just get into these questions. I know a lot of people are
Sure.
very just eager to find something that could help them out. So I have a couple questions here. So the first one that I got was, why is my mask causing me acne?
Because it's a constant contact.
Mhm.
It's like when football players, their helmet
Mhm.
on their forehead, they'll
Mhm.
break out. It's the same with our mask.
Mhm.
There are things that you can use that have like salicylic acid in them
Mhm.
that you could wipe off your skin a little bit after you
Mhm.
take a mask off, but make sure that you're always washing the mask.
Yeah.
Have a couple on hand and then wash them, or unless they're disposables. But
Yeah.
it's that constant friction
Okay.
is where it's coming from.
So do you have anything that could
It,
maybe help with that? Like, could they switch up the mask so that there's not as much oil on the mask, or is it?
I do have my image line the image line is wonderful. And just because I work in a plastic surgeon doesn't mean my products are real expensive, because I understand that college students, it's really
Yeah.
hard.
Yes.
But, sometimes it's more reasonable than what's down there at Macy's.
Well, yeah, and a lot of
So they have pads and they're really nice. There's like 50 in a jar and they work wonderful
okay.
for like when you take your mask off to wipe your skin off with those.
Oh, okay. Oh, awesome. Okay. And
Yeah, I mean, because we're going to be doing masks for quite a while, probably.
yeah, yeah.
And if you are already acne prone and you're
Mm-hmm.
already breaking out,
Mm-hmm.
that's doing nothing but irritating that. It's
Yeah,
stimulating that.
yeah, yeah. Okay. All right. And do you know, like, where could we get these products that you are talking about?
Well, they're right in my office at
Okay.
Parkway Plastic Surgery.
Okay. All right.
Um, you know, anybody's can call me anytime,
Mm-hmm.
and I do free consults.
Mm-hmm.
So, anybody that's listening to this, if they want to come in for a free consult and let me
Mm-hmm.
take a look at their skin
Mm-hmm.
and recommend products, I'm more than happy to do that.
There you
Like I said,
go.
my products aren't that expensive.
Mm-hmm.
So they're very effective. They're only in a doctor's office. So
Mm-hmm.
you don't have to spend $300
Mm-hmm.
products.
Mm-hmm. I mean,
When
and
you're paying
spend,
that much for products, then you're paying for the name and the pretty packaging.
yes.
But you want
Oh,
it to
yes.
do
And that's a big thing right now. Packaging and image and just I feel like a lot of people, like you said, don't really pay for what's going on their skin. They pay for what it looks like, and oh, look at how cute the packaging. And I know I've always done that. I'm like, oh, like sometimes I go for products that have the better looking um packaging or label, and I'm a sucker for it too. So, but yeah, I totally
well,
understand what
you
you're
know
saying.
what? I mean, I'd like to admit I like pretty packaging too. But with me knowing ingredients,
Hmm.
when you think about it, you want the product to work really well for you.
Yeah.
Because all you're going to do with that pretty packaging, that $200 container, is
Hmm.
you're going to throw it away when it's gone.
Yeah, yeah, you heard. Yeah. So awesome. Now I have another question, and this question was actually very popular. And I want to know all about it too. A lot of people were wondering, what can we do for dark circles? And
Right.
I know I have a huge problem with it. I stayed up till 5:30 last night doing homework, which I have not even done that in how many years? I don't know, but yeah, and I know sleep is a huge part with dark circles, and
Right.
somewhere, I'm not sure if I read this or some watched this, I don't know, but I did hear that vitamin C is really good for dark circles, so, or
It
niacinamide. So
is.
could you get into that specific ingredient and just things that we could do to alleviate these dark circles?
Right. Well, your vitamin C is,
Mm-hmm.
and you need to make sure that you have at least a good percent or over vitamin C in your products. Um, it depends on what's going on with the circles. When you're young, yes, it could be lack of sleep.
Mm-hmm.
Another thing is, unfortunately, hereditary.
Oh no.
Um, sinuses. Sinuses is another one.
Oh, okay.
If you have a lot of allergies,
Mm-hmm.
if it's a hereditary thing, there's not a lot that you can do for
Mm-hmm.
that. I mean, your vitamin C.
Mm-hmm.
So, like, if you take your vitamin C and you use it, it's something that you're going to have to use for the rest of your life. It's not
Oh.
anything that you use for a week or two and it's going to go away.
Mm-hmm.
But you should always use any kind of eye cream in that area anyway,
Mm-hmm.
because the molecules are made so much smaller in an eye cream and they're able to penetrate into that area than a
Okay.
regular moisturizer has a larger molecule.
That's so funny you say that, because I did hear that collagen masks, a lot of, collagen masks are very popular, but one thing that debunks them from working is that the collagen molecule is too big to even be like for to
Yes.
even enter our skin. So that's why don't buy collagen masks because they don't work. But um
They just feel nice.
Yeah, so if you're trying to get robbed, then go ahead. But
Yeah, exactly.
so okay, so
The best product that you could use would be a vitamin C.
that's okay.
And I would highly recommend to get it from a physician's office. If you get one over the counter, Kiehl's is a good one too.
Heels?
But still, Kiehl's,
Oh, Kiehl's.
Keils.
Okay.
Theirs is 50, and I have one that has a vitamin C that is 40.
Oh,
So you, like I
okay.
said, you don't have, just because I work in a physician's office doesn't mean my products are outrageous.
Right.
And
Okay.
the ingredients in those, the percentage are going to be a little bit more than what you get over the counter.
Okay, so it's better to just spend a little bit more. Like, I know there's vitamin C serums that are about $15 or $20. So you might as well go $5 or $10 more and not have to buy another one.
Exactly.
And
And have a higher percentage. You
have
want to
a
make
percentage.
sure when you look at your ingredients in a product, it's your first 6 ingredients that
Yeah.
are the most important ingredients in a product.
Okay, sweet.
They're
Thank
the
you.
most effective.
Okay. Now let's get into another topic. So let's see. Because I have a bunch of questions here, but I want to find a question that'll kind of cover everything. Now, okay, this is a good one. How do I get rid of blackheads? Now, this one's I feel like it's very tricky because a lot of people consider blackheads one thing when it's actually another. And I've done this before from what I know, and I'm not saying I know anything, but my personal experience, I know that sometimes when what I consider blackheads are sebaceous filaments. So could you get into that topic a
Yes.
little bit more?
Well, basically a blackhead is, it goes to the surface and it oxidites. That's where it becomes a blackhead. It's all that sebum that's caused down in there in your pore. And then when it reaches the surface, it oxidites. So that's when it becomes a blackhead. And how you get those out, you have to be very careful because you can really scar your skin when you start picking at your skin. Steaming, and that's a good way to get rid of them. There is something over the counter that you can use, the bori strips, as long as you use it on your nose or your chin area, but you wouldn't want to use anything like on your cheeks with something like that.
Okay, so those pore strips actually are good or okay to
Yes,
use?
as long as you use them on your nose or chin area. You can use them on your forehead too, but just don't use them on the delicate areas. As far as doing that over the counter, yes.
Okay.
The best way to get rid of them is come and see your esthetician
Look at you plugging yourself in, Julie.
and have it professionally done.
Oh, I love it. I love it. Now, that's from what I'm getting, it's more of like you have to learn to control them, but you can't really get rid of it.
Exactly,
Okay.
because it goes back to being hereditary.
Mhm.
A lot of people come to me and they want to know how they can shrink their pores. They talk about having large pores through their T-zone. Well, that's a very oily area anyway, and our pores are larger that way.
Okay.
And there's not really anything that you're going to do to change those pore sizes. You can just
Okay.
help keep them cleansed out.
Okay. That's
I mean,
interesting
I
because
do have laser machines.
Yeah, go ahead. Sorry.
Those are very expensive machines.
Oh yeah, yeah. That's actually funny, because someone did actually ask how could we minimize pore sizes, but I mean, it's not really something you could
But
do.
you really can't.
Mhm.
And what happens is, now I have a lot of women that come in, they're like in their 40s and 50s, and they're talking about their pores getting larger. Well,
Mhm.
what's really happening is the gravity taking over. Gravity, because, they elongate
Mhm.
is what happens.
Mhm.
They're not really getting long, they're not getting really bigger, they're just getting longer
Right.
because
Right.
gravity is falling.
Mhm. Okay.
But unfortunately, There's not a lot you can do to change your pore size.
Okay.
There are products over the counter that can give you a temporary look as
Mm-hmm.
far as filling in a little bit,
Mm-hmm.
but that's it. It won't permanently do anything.
Okay. Okay. So just maybe look into the market, see what kind of products could do that for, for this person who wants to know.
Yes.
Okay. Okay.
Yes. I don't know anything over the counter right off. I
Mm-hmm.
mean, I don't have anything like that
Mm-hmm.
because most everybody that I work with, they really don't want to do just a temporary thing. I
Yeah.
do a lot of laser resurfacing,
Mm-hmm.
which can help make them look refined, but I'm still not going to change the size.
Mm-hmm. Okay.
Now, you could go to a plastic surgeon
Mm-hmm.
and have one of the big
Yeah.
CO2 lasers done,
Mm-hmm.
but that's a couple weeks downtime. That's pretty intense.
So save your money and get that done. No, just kidding. But okay. Now another thing is, so a lot of people are actually very interested in knowing how to get rid of dark spots from old scars or just dark spots in general. So how could we do that? And I know, from what I know, I mean, you could exfoliate and that kind of helps get rid of the top dead layer, and so your skin regenerates and makes new skin cells. But that's pretty much,
Right.
I mean, that's just like the very surface of what I know.
Yes. Is you can go back to the vitamin C again because
Mhm.
you can also get serums not just for around the eyes, but
Mhm.
you can get it for the your whole face,
Mhm.
and also retinol. Retinol
Oh,
would
okay.
really help with that.
Really? Okay. So did was I
Retinol
misinformed?
is,
Was I
pardon me?
misinformed? Was I misinformed? Is exfoliating not a good way to do that? Is it too harsh or?
Exfoliating, when you're doing something like that, you're just going to basically get the surface dead skin. You
Okay.
need something for pigmentation that's going to go a little deeper than just on the surface
Gotcha. Okay.
because your pigmentation isn't just surface,
Mhm.
it's actually damaged skin cells.
Gotcha. Okay. Okay.
So you really need to find yourself some products with retinol in them
Mhm.
and vitamin C.
Okay.
Another product I have one at work that has like the glycolic acid, it
Mhm.
has vitamin C and retinol, all three in one.
Oh, wow.
So those are your three main ingredients that are going to
Mhm.
help you with your skin and help
Okay.
with pigmentation.
Oh, okay.
So
So for a skincare routine, do you advise to just go simple? Like, don't go crazy with the products. Don't get, blah, blah,
no,
blah, blah. Just is a skincare routine, the best skincare routine, the most simple skincare routine or
exactly. That is so true.
mhm,
You know, there's so many products out there that tell you you have to do this, you have to do that. You don't. Keep it simple.
mhm.
The best product that you can do for anti-aging is definitely your sunscreen. Definitely.
Oh,
That really makes a difference. I am an outside girl.
mhm,
I have a hard time staying in when it's beautiful out, but
mhm.
I just put my sunscreen on and I protect my skin and I enjoy myself outside,
Mhm.
but it makes a
Yeah.
difference.
No, I am huge on skincare, on, sunscreen. Like, I put that on every day, every morning, and so a lot of people get really surprised when they ask me, like, "What," not that, like, people ask me, but I'm just sometimes I tell people, like, "Yeah, sunscreen is, a really good thing to wear," and it surprises a lot of people to even consider sunscreen as something that's very crucial to a skincare routine.
Oh, it is. You should wear it every single day, even when we have our winters out, even when it's cloudy out. If
Mhm,
you wear your sunscreen underneath your moisturizer or whatever you use, your makeup,
mhm,
it's going to be a big factor on your aging
mhm,
and your pigmentation
okay.
because a lot of the pigmentation is also caused from the sun.
Mhm.
90% of our aging and problems with our skin is due to the sun. So we
Man.
have to be very careful.
Mhm.
Enjoy life, wear your sunscreen.
Yeah. Put that on a
And
t-shirt.
have a glowing face.
Yeah. Okay, now, someone asked, "How do I make my skin smoother?"
Exfoliating.
Exfoliating? Okay. Is
You,
there just getting a
yeah,
good
I would definitely use,
moisturizer?
I'm sorry, what?
Just getting like a good moisturizer, exfoliating. What
Oh,
else do you
definitely. Just, if you follow a simple skincare routine,
think?
you use a good moisturizer, use it in the areas that you feel dry when you're young.
Mhm.
If you feel dry all over, make sure if you're even acne prone that you use something that has a little hyaluronic acid in it.
Mm, okay.
That is the most moisture binding ingredient that you can put in a product,
Mhm.
and it's not acne prone. So,
Okay.
and that's also made within your own body.
Oh. Oh, okay.
Hyaluronic acid, yes, is a component that's made within your own body.
That's really cool. I had no idea. That yeah, who would have thought? But yeah, someone else asked what to do if you have really dry skin. Um, so how could we
The
alleviate?
hyaluronic acid in your moisturizer
Mhm.
really does play a big part. Now, a lot of places have where you can buy just the hyaluronic acid.
Yeah.
I don't know anything over the counter right now, but you can buy those.
Okay.
And that really makes a difference, especially coming up. And then you would put your moisturizer over the top of it
Okay. Oh, okay. So
to
is
help
this
seal that in.
mhm. So is this hyaluronic acid, is it good with any brand? Is it just, a product that
Yes,
doesn't really
yes,
matter if
yes.
it's 50 or 10?
No,
Okay.
no, that should be, try to find one that's a little more pure. I mean,
Mhm.
look on the product to see how pure it is.
Mhm.
I mean, don't buy one that it only says it's 10%. Get one that at least it's 90% hyaluronic
Mhm.
acid.
Okay. Oh, okay. Um, let's see, what else do we have here?
And when I said keeping your skin smooth,
Mhm.
just follow a good routine. Exfoliate every couple days.
Mhm.
Just remove that dead skin
Mhm.
because you're making new skin cells every 28 to 30 days.
Mhm.
And when the old ones reach the surface, they
Mhm.
get trapped with the things that you use on your skin.
Mhm.
So you
Mhm.
want to exfoliate that and have all your other products work better for you.
Okay. Now, I have this question in mind, because I've heard good and bad things about this, and it's the effects of water on your skin. Now, a lot of people say that drinking a lot of water does wonders for your skin, and it helps with acne, blah 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 blah. And there's other people that say, well, it doesn't really do anything. There's no proof that it has any effects on your skin. So, what's your take on that? On getting, hydrated and drinking water and how the effects on that on skin?
Drinking water.
Mhm.
Well, I think drinking water is better for you for, your well-being for your whole body.
Mhm.
And definitely you should drink water because if you don't, then you can see all these little dehydration lines on your skin,
Okay.
especially on your face.
Mhm.
So it is very important
Mhm.
to have that
Yeah. Okay.
because
Um.
not only does our body get dehydrated, your face is going to get dehydrated.
Oh, yeah. I saw somewhere that um, this girl had a bunch of wrinkles on her face, and all she did was, she got the right moisturizer, she got that hyaluronic acid, and she started drinking more water. So I was just curious to see, there's people that have, good, um, have been in a good situation and had good effects with water on their skin, and there's just other people, articles really, that say there's no
Yes.
real proof, but from what you're saying,
And,
water's very important.
well, the thing is too, it goes back with not one thing works for everybody.
Mhm.
It's like trying to find the one thing that really works with your skin.
Mhm.
Sometimes you have to go through a few things. When I have somebody come in for a consult, I will start by giving them just a few samples of some products to try
Mhm.
because maybe that's not going to work for them. If it
Mhm.
doesn't, then I can change and find something different.
Mhm.
So
Okay.
it's the same thing with people's skin. You really have to find what works best for you.
Mhm.
But water, water is a big factor.
Yeah, yeah,
That's good for everybody.
yeah. So, they don't die, right?
Exactly. You need your water.
Yeah. So, from what I'm getting, it's just this skincare, it's really different for anyone. and for everyone. And it's not really like it's a hit or miss. You just have to pull through and try and really um, find what works for you without being giving up and like, oh, I'm whatever, I'm giving up. It's
That's
kind
very true.
of.
You know, when you try something, people sometimes they want to try something for 3 or 4 days, think it's supposed to really work. You
Mhm.
have to try something for at least 6 to 8 weeks to really
Mm.
decide whether it's going to work for you,
So
unless you have
patience
a
is
reaction
key.
to it right away. You have
Yeah.
to stay with it.
Mhm.
Just anything that you use, like the retinols,
Mhm.
it's just a lifetime commitment. It
Mhm.
doesn't have to be a lot of stuff. It needs to be simple but consistent.
Okay. So this is the reoccurring theme here. Just if you want great skin, make sure to keep in mind, keep it simple and stay consistent. Be patient.
Exactly.
Yeah. Oh.
Simple and consistent.
Oh, awesome. Put that on a t-shirt as well. But okay, well, Julie, thank you so much for, meeting and talking with us and answering all these questions. I hope, you had a good time. So,
I did. It was wonderful. I'm glad
yeah,
that we were able to do it. And
yeah.
like I said, if anybody wants a free consult, they can come
Oh,
for a free
yes.
consult.
Yep, and
Just call
is
the
it
office.
yeah, I'll put your information in the or the bio of the videos. So if anyone has any
Okay.
questions to just call you and let you know.
That'll be wonderful.
Okay. Well, take care, Julie. Thank you so much.
Okay. Have a good Friday night. Bye
You
bye.
too. Bye-bye.